Hey guys, we're gonna talk about the ANS pharmacology part 2. Okay, so we're gonna talk about we have completed up to the Alzheimer's disease, and now we're gonna talk about the myasthenia gravis. Myasthenia gravis, what it is, guys? Basically, this is the decrease of ACH. So ultimately, this is gonna decrease in contraction, I guess. Decrease in. Basically, this contraction is getting talked about the muscles. Am I right or wrong? I guess I'm right here. So muscles are weakened or strong? Obviously weakened, na? Weakened muscles. Patient will feel fatigued. These are the बेकार की things. So now we're gonna talk about the treatment. What's the treatment, guys? सिंपल तो है यार. क्या ही करना अपन को? एसिटाइल कोलिन बढ़ा दो. Okay. So do we wanna increase the acetylcholine into the brain? Obviously no, bro. So that's why we're gonna use the water H2O soluble acetylcholine esterases. Okay, acetylcholine esterases inhibitors. What the fuck, bro? Why? Because acetylcholine is blocking the acetylcholine itself. So we're gonna block the acetylcholine esterase itself. Wow, क्या बढ़िया था. क्योंकि एसिटाइलकोलिन एस्टरेज एसिटाइलकोलिन को तोड़ रहा है, हम एसिटाइलकोलिन एस्टरेज को ही तोड़ देंगे. बढ़िया, समझे गाइस? And we're gonna talk about the water soluble irreversible acetylcholine esterase blockers, or basically you'll say like indirect acetylcholine implementers or increasers. So the first name was the neostigmine, and these all drugs are going to be used within the myasthenia gravis. The first one is the neostigmine, the second one is the pyridostigmine, the third one is the edrophonium. Oh fuck, edrophonium. The third one is, अरे पहले इतना तो पढ़ लो बे. Okay, so neostigmine, it's a quaternary amine, water soluble. इतना तो क्लियर हो गया? हाँ भाई क्लियर हो गया. Okay, it's long acting. ठीक है भाई. It's used as drug for myasthenia gravis prophylaxis. Okay, बढ़िया. Acetylcholine esterase decreases by the usage of this drug. बढ़िया. And can stimulate an M receptor directly. And this receptor will cause contraction, muscles strong. Cool. What is the use of this drug? Same as the neostigmine, but it is more long acting. Okay. What's the use of this drug, the edrophonium? Man, this is a very short acting drug. This has the same property as the neo and the pyrido, but see, it's extremely short acting drug. And do you know what's the usage of these short acting drugs? They are now useless, man. They can be used for the diagnosis, not for the prophylaxis, but they can be used as a diagnostic drugs. Why? एड्रोफोनियम आया, ओ बेंचो, इसको हमने दिया पेशेंट को, पेशेंट ने खाया, पेशेंट को अच्छा हुआ, मसल्स स्ट्रांग हुए, कुछ देर बाद मसल्स वीक हो गए. क्यों? बिकॉज इट वाज शॉर्ट एक्टिंग. चलो ठीक है, पेशेंट का बीमारी तो ठीक नहीं हुआ, लेकिन हमें ये तो पता चल गया ना कि मसल्स वीकेंड कहीं ना कहीं थे, तब तो इसको खाने के बाद मसल्स स्ट्रांग हुए. Am I right or wrong? You are right, bro. So we can use it as a drug which can be help us to diagnose the myasthenia gravis. Okay, so yeah, we are doing the same. myasthenia gravis में उन लोग क्या करना है, NM को स्टिमुलेट करना है, NM को स्टिमुलेट करना है, एंड दीज थ्री ड्रग्स आर डूइंग द सेम. ठीक है, हो क्या जाता है, एंटीबॉडी बन जाती हैं इस NM रिसेप्टर के अगेंस्ट में. क्या हो जाती है? एंटीबॉडी बन जाती है NM रिसेप्टर के अगेंस्ट में. सिम्टम्स क्या क्या आएंगे? मसल वीकनेस होगी, टॉसिस होगा. ये क्या होता है? आँख है, तुम्हारी पुतलियाँ हैं, ठीक है, ये क्या हो जाएंगी माइस्थीनिया ग्रेविस में इस तरीके से, ठीक है। इट्स एन ऑटो इम्यून डिसऑर्डर ब्रो। ओके, आई गेस इट्स ऑल क्लियर। Cool. So this is the edrophonium drug which is going to help you in differentiating between myasthenia gravis and cholinergic crisis. Okay, what's happening within this? Excessive stimulation of NM is happening, excessive, and here the NM is not working at all. So in the case of the edrophonium, it is going to increase the stimulation of NM, positive effect. We are sure that this is the myasthenia gravis. Yeah, bro, work done, mission completed. In this case, even more excessive effect of the NM receptor, man. The patient is going to die. What the fuck, ये हो क्या रहा है? मूत रहा हूँ मैं। मतलब what the fuck is happening with the patient? Negative effect, man. Why negative? Because the patient is in pain. The muscles are excessively working. The NM receptors are like they are getting stimulated a lot. Okay, so this drug can be used to differentiate between these two diseases, and this thing is called as Tensilon test. Okay, this thing is called as Tensilon test, or something also was that, like it was also called as melodine or something like that test. Okay, condition worsens in the cholinergic crisis. Condition gets better in myasthenia gravis. Okay. So basically, as you know, neostigmine is working over the NM receptor. It's treating the myasthenia gravis because it's a cholinergic drug, anticholinesterase blocker. So it's working over the M1, M2, M3 also. These are giving the side effects. What should we do now? It's working over the NM and making the betterment within the patient of the myasthenia gravis. But what's the use of muscarinic receptor if we do not have any issues with the muscarines? Block them, na bro. Block them. So what should we do? We're gonna give a muscarinic blocker called as atropine. Okay. So this phenomena is used within the myasthenia gravis. Okay. Within the patient of a cobra bite. Okay. What happens in this? The toxin blocks the NM receptor also. Okay, and the specified snakes were crate, rattle, no rattle, viper, dodge viper, and the cobra, king cobra, kala cobra. So NM receptors are suppressed. Why? Because of the toxins. Although DOC for these snake bites are antivenom only, but these NM receptor agonists can be used, which is the neostigmine. Okay. So this is a scenario with the snake bite. This can be used within the snake bite, within the cobra bite, within the snake bite, within the myasthenia gravis, and within the. And one more thing is that this can be used within the patients who are. What happens within the patient, like in surgeries, NM blockers are given. They are long acting, like Encodium or something like that. पेशेंट्स आर सीडेटेड, ठीक है, sedated with the help of NM blockers also. So what we give, the drug is the pancurdium, something like that, pancurdium. Okay, so after the surgery we want to revive the muscles of the patient na? So we want to give the neostigmine. Again what will happen? The same thing will happen, the muscarines will get activated and we have to stop its action with the help of atropine. So yeah, the neostigmine and the atropine are very good combo, bro. They are actually the best friend. The neostigmine plus atropine. So these are the Ramband. Wow. तू मेरे वाल तकदी रवे न मेरी तेरे तो नजर हटदी, मैं तेरा या ब्लड गोड़िए तू बैकबोन जट दी, मैं हो गया दीवाना बलिए तू हो के शदाई फिर दी. And one more thing is that this can be used within the post-operative paralytic ileus. This can be used within the post-operative paralytic ileus. What is this? We used to put the patient over the nil per oral. This relaxes the ileum and colons a lot, or maybe the whole GIT system. So we used to provoke the NM receptors after the surgery. Okay, the same thing happens in the post-operative urinary retentions. Okay, the same thing is happening. This can be treated with the bethanicol, I've told you in the last video, but we prefer the neostigmine. So the same thing will happen. We used to give the neostigmine, it will stimulate the NM receptor, and along with that we have to block the muscarinic actions with the help of atropine. Cheers. काली तेरी गुच्ची ते परडा तेरा नाल किथे चले ओ सोने ओ सच दच के. Now we have talked about the reversibles. Now we're gonna talk about the irreversibles. Okay, so the first one is the organophosphate, organochlorus, and the carbamates. Okay, basically organophosphate contains the insecticides. इसमें अंदर काफ़ी चीज़ें आती हैं यार, मगर इसको याद करो, ये तुम्हारे लिए बेटर होंगी, ज़्यादा आसान होगा इसको याद करना. This one contains the Baygon spray. Have you heard about? My family had an incident in which the Baygon spray killed one of the family members, so उसको याद नहीं करना अभी. They are highly lipid soluble, bro. Highly lipid soluble. They can even cross your skin layer. Okay. Used as insecticides. Okay. So due to this one, they can cause poisoning. Unknown poisoning. Who uses an insecticides the most? Yeah, bro. अपने किसान भाई, farmers, bro. So they are most prone to organophosphate poisoning. Now here to my thing. They are blocking the acetylcholine esterase. Am I right or wrong? So for sure, what are they doing, bro? What are they doing? They are stimulating the M1 receptor, M2 receptor, M3 receptor. What will this do? Increased acidity, stomach pain, maybe ulceritis in long term, bradycardia. Increased salivation, most commonly, and lacrimation. पेशेंट क्या करेगा? पेशेंट तुम्हारे सामने लेट रखा है ऑर्गेनोफॉस्फेट पॉइजनिंग का, ठीक है. चलो लेट्स इमेजिन ब्रो, ये पेशेंट थोड़ा माल है, देखने में अच्छा है, इसको वैसा बनाएंगे। ओवेंच याद होना चाहिए भाई, क्या गलत सही। ब्लू आइज वाला, ब्लू आइज हिप्नोटाइज तेरी करती है मैनू, आई स्वेयर छोटी ड्रेस में बॉम्ब लगती मैनू, glossy lips oh Fatrix baby लगती है killer, oh yeah oh yeah कत्ल करे तेरा बॉम्ब फिगर। Okay, bro. No. Lips should be pink, bro. Lips should be pink. गुलाबी होठों वाले लौंडा है ये. Okay. So this will be the condition of the patient with organophosphate poisoning. Okay. And this is someone who is Jawan. So this will be the condition of the patient who is with organophosphate poisoning, because the level of acetylcholine has been increased a lot. The acetylcholine is the cause of the poisoning. What should we give? We have to block this whole M series of receptor. Block them, bro. Block them. Just stop these things. The Ramban is the, what's the name? Think. ये बता दिया तब तो नीट पीजी पक्का है भाई. Think. Atropine, guys. What are you doing, guys? Atropine. So atropine is used and DOC for what? Organophosphate poisoning. What was the drug of choice for the snake bite poisoning, cobra bite poisoning? Antivenom, yaar. It was the antivenom. It was not this. It is the drug of choice for this atropine poisoning and with the carbamate poisoning also. And the most famous thing for the atropine poisoning, acetylcholine poisoning, is the pinpoint pupil. Okay, the pinpoint pupil. So basically this is the thing, and these are the things which are basically mentioned in this chapter, and nothing more than that, guys. The main thing was the atropine poisoning, and this is a drug which is used to reverse the patient, and the reversal has been seen just within the span of the 5 minutes. Okay, and this is the drug which is also used, and the drug which is used in the belladonna poisoning, the carbamate poisoning, is the atropine itself. Okay, so ACH reactivators can also be given, which are the oximes. Okay, drug name paralidoxime or diacetyl monoxime, PAMDAM. Okay, so these are the drugs which can be used, guys, for the reversal of the patient for the atropine poisoning. Okay, so thanks for watching, guys, and stay tuned to my channel. Please do like, share and subscribe.